Hello, my name is Madison Carter, and I'm one of the instructors here at A Plus Revenue Cycle Training. I have 10 years of experience in both medical billing as well as coding, and I've worked with a variety of different medical specialties, from pediatrics to behavioral health to neurology. I currently hold the CPC and COC credentials, and I'm also a certified CPC instructor. Today, I want to talk about coding guidelines, why they're important, and what you need to know about them to get started in medical coding. So, your coding guidelines are like your base or your foundation when you're trying to report both diagnosis codes as well as procedure codes. So, it's very important to know your general guidelines and all of your coding conventions. Now, it's not necessary to memorize every single guideline because that's just not possible, especially when guidelines change so frequently. So instead, you should be able to locate and interpret the guidelines that you need, especially your chapter, section, or code-specific guidelines. Now, ICD guidelines are all contained within the official guidelines for coding and reporting, which can be found in the front of the ICD manual. These guidelines are broken down into several sections, including how to select your principal diagnosis code, how to report additional diagnosis codes, reporting a diagnosis that is present on admission, and it also includes the chapter-specific guidelines that are reprinted at the front of each chapter for your convenience. Right. So coding conventions for use of the ICD manual are found in Section 1, subsection A. These explain how to use helpful features of the book, like your includes and excludes notes, your seventh character requirements, and abbreviations and symbols. General coding guidelines for the use of the ICD manual are going to be found in Section 1, subsection B. And these describe how to handle different scenarios when you're coding, like when you can report signs or symptoms, how to report a condition that is described by the provider as both acute and chronic, how to use combo codes, and what to do if a provider documents a borderline or probable diagnosis. Now, you should memorize all of your conventions and general coding guidelines except your hurricane aftermath encounters, as this isn't going to be asked about on the CPC exam. But you should have memorized Section 1, subsection A, and Section 1, subsection B. All right, we're going to move on now to CPT. So, unlike the ICD manual, the CPT doesn't organize its guidelines into very neat sections and subsections. So, when it comes to the CPT manual, you have to know how to hunt for the guideline that you need. General guidance is listed in the introduction, primarily under these headings that I have here on the slide. Now, the most important ones that you'll need for the exam are going to be your add-on codes, modifiers, time, which is for E&M, and we will cover that in a later session, as well as your code symbols. And the code symbols are going to help you use the book in a more efficient way. Now, you'll mostly be referencing your section-specific guidelines, which are going to be found in the front of the E&M, the anesthesia, surgery, all of those good sections in the CPT manual. Now, these guidelines are specific only to their section, but they may have some overlapping concepts like special reporting. You should have these section-specific guidelines and the introduction guidelines that I mentioned on the previous slide memorized to the best of your ability. Additionally, you'll also need to reference what I like to call code range specific guidelines. Now, this isn't the real term. Most people are going to refer to these as CPT guidelines, but I feel like that's kind of confusing. What I'm talking about when I say code range specific guidelines are those little paragraphs of information that are found throughout the numeric section. Like as you're flipping through your codes, you may see a little couple paragraphs of information that's talking about those specific codes that you're looking at. That's what I mean when I say code range specific guidelines. Now, you can't memorize these, it's just not going to be possible, but you should know how to find these and how to use them when you are reporting codes that are going to be listed there under those code range guidelines. Now, these guidelines apply only to the codes under the same header, so they don't apply to any other codes unless they specifically mention one in those paragraphs. I highly suggest flipping through your CPT manual, read through some of those guidelines. You don't have to read them super close if you just want to skim them a little bit. Highlight some lines that sound important with different highlighter colors. Now, because it can be hard to study from the guidelines listed in the manual in one big chunk like that, if you are planning on studying, I recommend making flashcards with one guideline each so that it breaks them down into bite-sized pieces to study. You can also start eliminating cards as you memorize the guidelines. So this way you'll have a progressively smaller and smaller deck to work from, and then that way you can really focus in on those ones that you still don't know.